If your joints ache more than they used to, and you've been telling yourself it's just old age, doctors want you to know that's not always the full story. There can be subtle signs of inflammation affecting your joints, sometimes before the problem becomes obvious. And by the time most people notice, the inflammation has already been building for months. Stick with me for the next few minutes, because sign number 4 is the one almost every senior mistakes for something completely different, and it might be the most important one on this list. Joint pain after 60 isn't always just aging. Doctors say there are silent signs of inflammation building up inside your joints, signs most people brush off as normal, blaming it on the weather, on getting older, or on just being tired. Persistent inflammation can sometimes contribute to joint damage, depending on its cause. That's why recognizing these symptoms early and getting the right diagnosis matters. Today, I'm walking you through 5 silent signs your joints may be inflamed, what's actually happening inside your body when they occur, and what doctors recommend doing about each one. If you or someone you love is over 60, this could be the video that helps you catch something early. Let's get into it. Waking up a little stiff is completely normal. Your joints have been still for hours, and it takes your body a few minutes to get moving again. But here's a useful clue doctors pay close attention to. A pattern of morning stiffness lasting 30 to 60 minutes or longer can be a sign of inflammatory arthritis. Osteoarthritis-related stiffness, on the other hand, is usually shorter and tends to show up after periods of activity or inactivity, rather than first thing every single morning. If you've noticed you're the last one out of bed lately, or you sit on the edge of the mattress for a while before your joints wake up, that timing actually matters more than you'd think. Doctors recommend gentle stretching the moment you wake up. Even just rotating your ankles and wrists while still in bed helps get things moving. Staying hydrated throughout the day also supports your overall joint and body function, though it isn't a treatment for inflammatory arthritis on its own. If your morning stiffness has been creeping past that 30-minute mark for weeks, doctors say it's worth mentioning at your next appointment, not something to just push through and forget about. This sign can be easy to overlook, especially when the warmth is mild and there's no real pain attached to it. A warm, swollen joint can be a clue that inflammation is active, although warmth can have other causes too, so it's one piece of a bigger picture rather than a standalone answer. Many seniors notice this in their knees, knuckles, or ankles but dismiss it, assuming it's just circulation, arthritis they already know about, or simply the weather changing. Doctors recommend a simple at-home check you can do in seconds. Place the back of your hand on one knee, then the other. If one side feels distinctly warmer, or a knuckle feels warm compared to the ones right next to it, that temperature difference is worth mentioning to your doctor, even if there's no visible swelling to go along with it. Most people think of swelling as something caused by an injury. You twist your ankle, and it puffs up right away. But inflammatory swelling can behave very differently. It can appear with no clear cause, last a day or two, and then disappear almost completely, only to return again a week or two later. Swelling that repeatedly appears without an obvious injury is worth paying attention to, especially if it keeps returning in the same joint. If you've noticed your fingers feeling tight some mornings and perfectly fine on others, or your knee looking slightly puffy every few days without any injury to explain it, the pattern is worth tracking rather than shrugging off. Doctors often suggest taking a quick phone photo every few days. It makes the pattern much easier to spot than relying on memory alone, especially weeks later when you're trying to describe it to your doctor. Here it is, the sign almost everyone misses, because it doesn't feel like a joint problem at all. It feels like just being tired. You may think you're simply getting older, sleeping poorly, or running out of energy the way everyone eventually does. But when unexplained fatigue shows up alongside joint stiffness or swelling, your immune system may actually be giving you another clue that's easy to miss if you're not looking for it. Here's the science behind it. When your immune system is dealing with ongoing inflammation, It releases proteins called cytokines into your bloodstream. And the same proteins linked to joint irritation can also affect your energy levels, sometimes leaving you feeling drained even after a full night's sleep. Doctors say the key clue to watch for is a mismatch, feeling exhausted on days when you haven't done anything physically demanding at all. If that sounds familiar, and you're also noticing any of the joint symptoms we've already covered, doctors recommend asking about a simple blood test for inflammation markers like CRP or ESR. These tests can help your doctor determine whether inflammation may be present, but they're always interpreted alongside your symptoms and other tests, never as a standalone answer on their own. Struggling to open a jar, twist a doorknob, or hold a pen the way you used to is worth paying attention to, even if it feels like a small, everyday annoyance. A gradual loss of grip strength can sometimes accompany problems affecting the hands, including arthritis, but it can also have many other causes, like nerve issues or general muscle loss that comes with age. Doctors recommend keeping an eye on any steady decline in grip strength over time, especially alongside any of the other signs we've covered today, and discussing it with your doctor rather than trying to self-diagnose from home. Small changes are worth mentioning to your doctor when they persist or keep getting worse. If you recognized even one of these signs in yourself today, don't panic, but don't ignore it either. Talk to your doctor about whether an examination and, if appropriate, blood tests could help identify the cause. Catching things early is almost always easier than dealing with them later. Which sign surprised you the most? Let me know in the comments below, and subscribe for more doctor-recommended health tips after 60.